Contaminated drinking water in Canada. Some background on this global health problem. The UN recognized in 2015 that it is a human right to clean drinking water, but we still see that this is the most significant long-term risk worldwide. There are 1.8 billion people currently still drinking contaminated water. More children are killed by contaminated drinking water than by malaria, war, HIV and AIDS, and traffic accidents combined.
Why is contaminated water still a global health problem? Generally, there is a misconception that this crisis only affects poverty-stricken areas. However, the reality is much different. In fact, low and middle income areas are also affected. 38% of health facilities don't have clean water. This population is at a risk of disease transmission through contaminated water. Another reason is that there isn't enough media coverage on the reality of the situation, as well as the interventions meant to tackle this problem. For these reasons, it is difficult to collect funds to resolve this issue.
We decided to take a further look into this issue in Canada. Why is Canadian water contaminated? It is due to pollution from oil sands, mainly oil from Alberta's tar sands. It is also due to the pollution of the Great Lakes. This is due to industrial waste, which has introduced toxic chemicals into the Great Lake waters. It is also due to soil pollution from chemicals. These chemicals include pesticides, acid rain, oil and chemical spills, and road salt. What is the rationale and significance of our issue? In Canada, this issue affects First Nation communities, especially on reserve lands. 73% of First Nation water systems are at medium to high risk of water contamination. 120 communities are on boil water advisories in Canada, and they have been for decades. We decided to take a further look into Ontario. 90 out of the 134 First Nation water systems on advisories are in Ontario. There was a recent E. coli outbreak in the community of Walkerton, Ontario, where there were 7 people dead and thousands that were sickened. There are currently some organizations that exist in Ontario to tackle this problem. However, there is a problem that these organizations face. There is lack of water quality regulations, insufficient funds, faulty or substandard infrastructure, and degraded source waters.
Our initiative aims to help create awareness for First Nation communities in Canada, specifically in Ontario. The Clean Water Foundation. The Clean Water Foundation is a Canadian non-profit organization that is dedicated to preserve, protect, and improve our waters, especially water systems on reserve land, while working with the public, private, and charitable interests to create policies and programs that help solve issues such as water efficiency, non-point sources of pollution such as pesticides and automotive chemicals, and emerging chemicals in waters due to pharmaceuticals and personal care products.
Our intervention is to raise awareness on this issue. We aim to raise awareness on the issue of contaminated drinking water in Canada in general, and the need for funding and services on this issue, and also the need for policy change for more government support on this issue. We will raise awareness by creating a GoFundMe page for the Clean Water Foundation, and we will create a petition on this issue on the change.org website. Our goals and expectations are to receive funding through our GoFundMe page to support the Clean Water Foundation. We will also write a letter to Ben Lobb, the MP of the Huron-Bruce electoral district, to raise awareness on the issue and funding for organizations supporting communities in need. This letter will include a copy of our petition signature list. We chose the Huron-Bruce area because it covers the Walkerton community where there was an E. coli outbreak previously mentioned.
Some limitations to our intervention are that our target audience may not have awareness of our funding page and petition, mainly due to the lack of internet service. And unfortunately, some people have misconceptions and carry negative stereotypes towards First Nations people, and these individuals will most likely be less inclined to donate and sign our petition. Hopefully, our intervention will still be successful even with these limitations and project time constraints.